Question number 8. Order. Question number 8, Barbara Stewart.
Thank you, Mr Speaker. My question is to the Minister of Health and asks, what is the average waiting time in hospital, accident and emergency departments?
Honourable Tony Ryall.
Mr Speaker, I'm advised that the Ministry of Health does not collect a national figure for the average waiting time to be seen, but the latest results of the Emergency Department health target is that 93% of patients were treated, admitted and discharged from an emergency department within 6 hours. I did do a ring around this morning and can advise a couple of hospital average lengths of stay in emergency departments. That's the average time a patient spends in the emergency department, including getting their treatment. At the North Shore Hospital, the average time a patient spends in their ED has decreased by nearly 4 hours since 2008, from 7.5 hours to 3.5 hours. And I'm told that the average length of stay, including treatment, at the Whakatane Hospital ED is just over 2 hours, and the Christchurch Hospital is 2 3/4 hours. I do have to say to the member, there will occasionally be times when patients experience a longer than anticipated wait in an emergency department, which may be the result of a combination of factors such as the seasonal flu.
Supplementary question, Barbara Stewart.
Thank you, Mr Speaker. What does the Minister have to say to 82-year-old Mr John Francis Cornell, who, after being taken by St John Ambulance to Palmerston North Hospital, waited for more than 9 hours without being seen?
Honourable Tony Ryall.
Mr Speaker, I'd ask the member to bring that case to my attention and I'll look into it. I have to say that 9 hours is way outside the 6 hours expectation that one would really expect in an emergency department, and I have to say that we'll look into that because that is unacceptable performance.
Supplementary question, Barbara Stewart.
Would he personally expect to be seen by a doctor within 9 hours of waiting at a hospital if he was suffering bleeding from the bladder? And he has said that this is unacceptable.
Honourable Tony Ryall.
Mr Speaker, that is completely unacceptable, and yes, I would expect to be seen, and that is the reason why the government has instituted the target requirement that patients be treated and seen within the emergency department within 6 hours at 95%. I would say to the member, if she brings that case to me, I will check the circumstances and will make sure that what she's been advised is correct, and we'll make sure that that sort of case is drawn to the attention of the District Health Board. It's completely unacceptable.
Very nice.
Supplementary question, Barbara Stewart.
Will he acknowledge that the government's initiative to provide better, sooner, more convenient health care is actually poorer, later and much less convenient?
Yes, it is.
Mr Speaker.
Order. Honourable Tony Ryall.
Mr Speaker, no. As that member well knows, we have massively improved the level of service that New Zealanders are getting in emergency departments and then their hospitals. That member will recall that it was only 5 or so years ago that old people lay on hospital trolleys in corridors at the North Shore Hospital under bright fluorescent lights for more than 3 days on end.
Supplementary question. Yeah. Order.
They're very happy I'm asking one.
Order. Supplementary question, Honourable Annette.
Thank you, Mr Speaker. Does he agree with Mike Ardar, the designated ED health target champion, who said recently there is no standard measure for readmission back into hospital after discharge from the ED department within 6 hours, and there ought to be? If so, is he going to do something about that measure?
Mr Speaker,
Honourable Tony Ryall.
Mr Speaker, if that was the circumstance now, it was certainly the circumstance when that member was Minister of Health for 6 years. What I can tell the member is that...
I have a point of order.
I asked a straight question. It's nothing to do with what happened when Labour was in government. He either has an answer for it or he doesn't.
Order. Does the member require the question to be repeated again? Okay, would the member please answer the question? No, order. Would the Minister please answer the question? I apologise.
Mr Speaker, hospital readmission rates are measured generally across the sector. What I can assure the member, as I'm sure she was told by Professor Ardagh, we are working with clinicians in developing a suite of quality measures to indicate the level of performance within hospital emergency departments. Things are certainly improved what they were when that member was Minister of Health and people waited for days on end in hospital emergency departments.
Question number 9, Dr Paul Hutchinson.
Thank you, Mr Speaker. To the Minister of Health, what report